Hello everyone, I'm Dennis McCarthy with Olean General Hospital and the Upper Allegheny Health System, welcoming you to a special edition of Inside Olean General Hospital. Our health system and our hospital hosted a very special speaker here in Olean to talk about an issue that's very, very serious to the nation's health. Obesity in America. It's a problem that pervades this entire country, in every town, in every state, across this nation. We were pleased to have Bill Purcell, a leading expert on obesity, speak to a group here in Olean. Bill Purcell is an expert in leading collaborative efforts. He's former mayor of Nashville and the former majority leader of the Tennessee House of Representatives. He's vice chair of the Committee on Accelerating Progress in Obesity Prevention at the Institute of Medicine of the National Academy of Washington, D.C. He's currently chairing its roundtable on obesity solutions. So it's with pleasure that we invite you to watch this presentation with Bill Purcell.
Most importantly for me, and where I begin tonight, I think, is that in half a generation, we have reached a rather remarkable consensus, broad agreement, let's say, about the threat. And what I'm here to say is that we believe now that we know what to do about it, and we start then with where we are. At least that's my hope. Pretty straightforward, not terribly complicated scientific equation. Calorie consumption is up. Portion sizes are larger with more calories in them. In particular, sugar-sweetened beverage consumption is high, but the basic concept is calorie consumption is up. And at the same time, physical activity levels have decreased among kids and adults, while sedentary activity has increased in part because of PowerPoints and computers and games and all of the rest that we know so much about, but calories are up and the consumption of them are down, and it's so simple to say and yet so hard rather, to deal with, and the effect is huge. Those are the stark, hard numbers nationwide. 1 out of 3 children are overweight or obese. 2 out of 3 adults overweight or obese. And those numbers truly climbed at exponential levels. Any graph you look at, any chart that you study, shows incredible increases. The reports lately, very recently, suggest a leveling off in the epidemic overall. Were it true, were it sustained, were that where we stayed, it would mean, however, we would have an epidemic in progress in terms of numbers of that size forever. The local data in this case becomes critically important, that we track it and know it and understand it, because it's too easy to think it is somebody else. The good news is, in this county, in this region, but particularly here in Cattaraugus, you have said, when asked, that it is the #1 public health issue within the region. And that's a huge part, a critical part of beginning, I think, to move here. The health consequences, everyone in this room who's associated with Upper Allegheny or knowledgeable in any way about it can speak about this much more, I think, compellingly than I will be able to or most others. That's just a short list of the kinds of health problems that are confronted in the hospital, in doctors' offices, on the streets, in the schools, across this country. From type 2 diabetes to the psychological effects of low self-esteem and stigma, all parts or pieces potentially of depression, and ultimately functional effects, which include unemployment, reduced productivity, and the like. Those health consequences, again, some pretty stark numbers. 11% of adults have type 2 diabetes. When you think about numbers this large, they are unlike most other kinds of health challenges that we think about. These are huge. 37% of adults are considered pre-diabetic. Think about that, more than a third. Think about the people in this room. Look to your left, look to your right. Maybe not you, the people on each side of you are at risk of this very incredibly difficult and dangerous disease. And the numbers get even more complicated when you deal with Latino and Black children, where at least a half of them will develop, it's predicted, type 2 diabetes. A third of all children today will develop type 2 diabetes within their lifetimes. So what does it cost? Lots of different ways to tease it out, but let's look at a global scale. And these are fairly conservative estimates. $190 billion every year. $4.3 billion just from business losses, the kinds of things that happen when you have to go to a doctor's appointment, when you are unable to work, you're on sick leave, all those things that are related to obesity. That's just the direct business cost. But look at that number in the corner. 21% of all medical spending in the country is believed to be associated with obesity-related illness. At a time when we're talking about controlling healthcare costs, when we're concerned about the way healthcare budgets are increasing from the university level to the American government's level, wherever you are in that continuum, the notion that 1/5 of all of the money you're spending is related to a particular epidemic is incredible. And in New York State, you look up and find yourself number 2 in American states in medical expense related to obesity. And on this slide, in this context, are costs that, frankly, we haven't begun to quantify, some of which we have not yet identified. Whether you've been on an airplane or at a hospital, where now the wheelchairs have become the size of compact automobiles, or they're large, they're big. They're large vehicles that are in the hallways of our airports and of our hospitals and of our waiting rooms, and you know that very, very well. New airplanes will have new airplane seats in this world. And the cost of that is very difficult for us to fully understand and appreciate, but it means less capacity on the airline, higher fuel costs associated with each passenger that flies, all related to changes in us. In beginning this process, we went back and looked over the preceding 10 years and looked at over 800 obesity prevention-related recommendations, both from the government and from the private sector, foundations, governors, the National Governors Association, the National Association of City and County Health Officials, Robert Wood Johnson, the usual suspects and more, and looked at all that they had proposed as both a cause and a solution. And particularly, this particular focus within the IOM began in the year 2005. And from that, the Committee on Childhood Obesity Prevention was, I think, a classic in its type. It included a wide range of individuals from academia, from all across the country with a variety of backgrounds, from kinesiology to medicine. The work that they did throughout this period of time, these are just a simple set of workshops and the work product from those workshops, all of which are still available to you online, that range from the community perspective in the early days through a specific focus in the state of Texas, across the United Kingdom. They then began to focus as well on issues of disparity, the need for alliances and finding common ground, and then specific legal strategies in children. Additional consensus studies were produced during this time period. 2009, this was the local government consensus study where they looked at what was going on in cities all across the country. I would highlight in particular the city of Somerville in Massachusetts. It is a place where a mayor and a city have come together in a unique way, but there are many other examples within that particular study. Ultimately, some focus as well on the way in which we analyze the evidence for the purpose of public policy. For the scientists in the room, this was a particular challenge for us in this field because we couldn't wait a generation or two for randomized controlled studies to be conducted in order to decide where we ought to direct resources and the way in which we ought to proceed with policy. So this effort was undertaken to try to find a simpler, more straightforward, faster way to make recommendations at the local, state, and federal level for policy changes in the face of an epidemic that was right then in front of us. And then more recently, a particular focus on the issues of early childhood, about which we've seen some good data recently, but the core issue we know from the data that I think is generally agreed about, young children who develop obesity are much more inclined to remain obese and fight obesity throughout their lives than young children who are able to avoid that problem in those early stages. And that led ultimately to this study that is at the core of my remarks today, the Accelerating Progress effort. One last thing in terms of background is the weight of the nation. In the 2012 effort, HBO came and filmed every working session of the committee. HBO then went out across the country to look both at the places that were struggling and the places that were acting to address the problem in real time. Nashville plays a role in that story, but it's a national story with national coverage. It's a 4-hour set of specials that occurred during the year 2012, and it's still available online and still has lots of, for the academics in the room, lots of teaching materials attached to it, most all of which are obtainable for free from, again, directly online or from the company, from HBO. Most recent report is specific to the school environment, May 23 of last year, physical activity in the school environment. Again, very targeted and very directed to the school, but I think a part of this larger story of research that underlies what I'd like to talk about here very quickly, which is how we can think about accelerating progress in America. We started at the beginning of our deliberations with 5 straightforward goals, which we believed would define the solutions. First, and they are not rank ordered here. Each one we believe is critically important. First is to integrate physical activity every day in every way, and I would add for everybody. Secondly, a goal to make healthy foods available everywhere. And we meant, and I mean everywhere. Third is to market what matters for a healthy life. Marketing just flat matters. You know that. I believe the director of marketing is here. This is not a salute to you. It is a recognition that the marketing that goes on in this country is among the best marketing that's ever anywhere in the world in the history of the world. And we have a need to be attentive to both what is happening and what needs to happen in terms of the message being delivered. We need to activate our healthcare and our general employers to be a part of this. The private sector is absolutely critical. And fifth, again, not rank ordered at all, we need to strengthen schools as the heart of health. In physical activity, we know what needs to happen. I think we've been working quite hard at it across the country, some places harder than others, but the need for us to come together as individuals, but also as those professionals whose job it is to be responsible about transportation and planning, the health professionals within an area who know the connection between the availability of green space, of walkable space, of accessible space, to the ability of people to actually participate in the physical activity that we're telling them they should participate in. Bottom line right now, 20%. 1 in 5 of Americans get the amount of physical activity, a minimal amount of physical activity that is recommended for this purpose. You'll find this kind of set of strategies throughout the report in each of the areas. And each strategy then has further supporting materials. And my purpose tonight is not to take you through all of the strategies and all of the supporting efforts. It is to, in the fastest way I know how, present to you that these are things, many of which you know. You knew intuitively. They are, it turns out, scientifically and in other ways provable as critical pieces to the solutions within this challenge. And more importantly, they are things that we can do. Focusing on the physical and the built environment is something we can and know that we should do within communities, making it possible for people to walk, making it possible for people to be outside, providing and supporting the programs that allow those things to happen. I believe the leadership of the YMCA here in Olean is here tonight. The Y has known this from its beginnings. The notion is, though, that basic understanding within the Y is one that we all ought to share, and that public policy in the physical and built environment within the city should follow as well. Requirements nationally, as well as attention to those requirements for physical activity within the child care setting. And then finally, a need for a greater amount of focus on the science and the practice of physical activity, the academic support that's needed in kinesiology and related fields to be sure that we understand what works best in order to address the physical activity needs of our citizens. Food and beverage environments, again, specific recommendation that there needs to be an effort to reduce unhealthy food and beverage options and increase healthier food options. We all know you can have the greatest desire in the world for the right choice. If it's not presented, if it's not available, it's not going to occur. And you can let your mind wander back to your school cafeteria, well, some years ago. You remember the choices that were available then. there is a great change in school cafeterias, and the best cafeterias now have made incredible changes in the healthy options that are available to students within the school setting. There needs to be clear focus and attention paid in all of our schools, but more importantly, across the board to increase the options that are available to our kids. And here are the set of strategies that follow. They range from the availability of those options. Where are the water fountains? Where are the water fountains? The water fountains that were omnipresent in all public facilities and most private sector settings disappeared, to be replaced in many cases by individual portions of products that were very different in their caloric makeup from the water that they replaced. Nutritional standards, we recommend, are a part of this process. Incentives that can be utilized by cities to encourage grocery stores and farmers markets and the availability of produce, particularly in those communities where they do not exist. And lastly, a need to focus on what our own national policy is doing in terms of diets and obesity, in particular the Department of Agriculture. It is an area where they are focused. That focus needs to remain. Back to the message. Everyone has a role here as well. The number is there. Older children and adolescents consume, it's estimated, 7.5 hours of media each day. The number is striking. It's astonishing. Now, I think this will count as part of your dose, but one hopes there is some payback from it. For an awful lot of that time, there is not much payback at all. Again, a set of strategies which range from targeted physical activity and nutrition social marketing programs. And you can think in this regard about perhaps the most successful social marketing program that I am aware of, which would be in the seatbelt area. You can think of the Keep America Beautiful campaigns that were so successful. The jingles in both of those areas, actually, if you just think for a moment, come back to mind. I won't start it because you'll be humming them all night, but they were effective marketing campaigns. And the anti-smoking campaigns, although different in different places and at different times, are another example, at least, of the ways in which when we were focused and resources were devoted, we were able to communicate clear messages, not just to children but to adults, about what's good and what's not so good. Standards in that area, we think voluntarily can be and are to some degree underway now. Consistent nutrition labeling on the front of packages, on shelves. I was at a famous upstate New York coffee establishment on the way down here. And there was. Here were 3 choices for breakfast under 300 calories. Now, I had no clue what anything else in the case might have had. The things that I was particularly drawn to, the blueberry muffin, which you think of as a diet food, of course, you know is not, ever. But in this case, I saw the number, it registered with me, I saw the 300 calories. What was missing, unfortunately, at least where I was standing, was the anchor to that number. Because there's actually some data that indicates if you're not careful to explain to people what that means, if many people have given the choice between, 1,000 calories or 1,200 for the same price, we'll buy 1,200. Why wouldn't you buy as many calories as you could buy with the money that's available to you, particularly if you're challenged in the amount of money or resources that are available to you? It needs an anchor, it needs explanation, it needs a strategy about the messaging so that people understand and make a knowledgeable and, one hopes, appropriate decision for them. It's all about marketing in this area, and there's lots more that can and should be done and said about that. 4th area of concern. Again, simple to say, harder to implement, but we're all involved. Healthcare companies, healthcare businesses, hospitals, the people in this room, insurers, and work sites. Kind of all of us need to think about what we're doing to support the structure for achieving better population, health, and obesity prevention. And that involves things from standardized care within healthy community environments, to coverage of and access to routine obesity prevention, screening, diagnosis, treatment, encouraging active living coming from not just the words, but the modeling and the behavior of an employer, and then encouraging healthy weight gain during pregnancy as well. So I'm on the 12th floor of my building in downtown Nashville. I've been to a meeting of lawyers. I'm on the 18th floor, and I think it's time to walk. It's just 6 stories. I'll walk up to 18, and I do something which it turned out no one had ever done before. I throw open the exit door, I march into the staircase, I go up 6 stories. I'm feeling very good about myself until I realize I can't get in that door on 18. And actually, the door on 12 is now locked behind me as well. And I'm thinking, 6 stories up wasn't bad, but 18 down, I don't care, is going to be a problem. And thankfully, cell phones exist, and my office staff was able to find the place where I was. They'd never been there either, and they got me out of there, and I came to speak to you. But there are things that employers need to be thinking about, involved in, every day in ways that will affect their employees and their own lives as well. And now, in this area of schools, and I talk about it because it's critically important, but at the same time, honestly, it's important that I be careful about what I say here. Because there's no question in our minds, when you look at that number, 1/2 of children's waking hours being spent in school, we know how much can be accomplished. On the other hand, most of the people in this room have spent a lifetime hearing, we'll let the schools handle it. Almost whatever the problem was, someone would say, well, they can take care of that in schools. And in some cases, it worked quite well. I received my polio vaccination in school. Health care and schools can and have historically been connected, but the notion somehow that we would charge our schools with ending the obesity crisis is quite mistaken. It won't occur, and in the end, we'll find ourselves competing with other efforts and other needs. Our schools, however, can be what we would describe as the heart of health, and they should be in that way then places that do actually require physical education and provide opportunities for physical activity in schools. Most parents today think that there is physical activity of a kind that we recall going on in most schools. And if you're knowledgeable in this area, that would be wrong. The notion that many of you may remember, dressing out 3 times a week, going out and doing whatever it was in a very organized way, is not occurring in most schools, most days. It's a basic requirement. It's a simple need for 60 minutes at least a day of physical activity, of PE and other activity. It doesn't have to be in PE. But the notion that 1 hour a day you should be active is something that everyone can grasp and understand. But our schools need to help us not just understand what it means for us, but then implement that as well. Same thing with nutritional standards there. And finally, food literacy. There was a time when that was also a part of what was talked about in a broad way across school systems. It can and should be again. Food literacy, it turns out, is critical to life as well. Again, we all have a role, but schools can be the heart of that role, and that's what our strategies in that regard suggest. When you look at it, there they are. There are 5 basic areas, and on that slide you see schools there at the heart of health. But the words that are right below that, if you can read them from where you sit, are equally important as well. Any one of these areas, work in any one of these areas can make a difference. But the truth is, the only way you're going to end this epidemic, in our opinion, and do it in real time, in a time that will really be meaningful for us, is if we do them all. And basically, if we do them all at the same time. Who needs to do it? All of us. That's the other piece of this. This is not one of those problems where you can say that actually is something that the mayor handles. I don't have to worry about that. That's something that the president or the CEO of the company handles. I don't have to worry about that. Actually, in almost all of these areas, each of us has some part to play. What do we need to do? Again, it's all of it. It involves all of those areas of concern if we're really going to change our world. And the truth is, we have to do it right now. It is our problem, it's our epidemic, and these are our tragedies. Now, in America, and specifically in this county, when looking at the statistics, and I started to take you through them, but they're available online, and actually it turns out from reviewing the focus groups and the other polling data done in this county, and the specific reports done here in the last actually year and a half, I thought a bit of Lake Wobegon. This could apply any place where all the children are above average. There are a lot of above average children and adults here, as there are in the balance of America, but it's not good. Having said that, however, average in these studies is not good. Average is a bad number. The notion that you are worse than any other county or population should trouble any of us, but the reality is it's an epidemic in the whole country, in all of the counties, and everyone's facing it, and everyone has to deal with it. The truth of that matter is very simple. Average numbers are a problem for all of us everywhere. The good news from this county, from here, from home, is that when asked about the priorities, the people of Cattaraugus County said first 5 priorities in a collaborative health survey done last year. Number 1, exercise and more activity. Number 2, jobs. Number 3, smoking. Number 4, nutrition. Out of the top 4 concerns identified without direction, exercise and nutrition. And number 1, self-identified by the people in this county, was we need more exercise. I think that's quite extraordinary. The notion that all of this messaging, both what little we've done in this area of obesity prevention and otherwise, still has translated into a basic internal belief that we need to do more in that area. When people here are asked, what are the 3 issues you are most concerned about? Again, no prompting. What are you most concerned about? Number 1, obesity. Number 2, health insurance. Number 3, physical activity. Number 4, nutrition. Ahead of cancer, ahead of heart disease, ahead of alcohol and drug abuse, ahead of care of a spouse or a child. Those are your numbers from your neighbors, representative of this county right now. And I think that's extraordinary and encouraging in ways that few other things could be as encouraging. The focus area, number 1 focus area for 2014-2017 right now in your Cattaraugus County public health commitment is to reduce obesity in children and adults. That's in your Community Health Improvement Act. That's where you're headed. The Buffalo News, Sunday, lead editorial celebrates some better numbers from our youngest children and a reduction in that area, but spends most of its time dwelling on the fact that the problem of American obesity in children and adults has been a slow-motion train wreck that has serious consequences. Childhood obesity, which has reached epidemic proportions in this country, and then strong discussion of the effect. They describe it as threatening the nation's security. Buffalo, New York, this Sunday, an ideal focus and effort on what we are accomplishing, but more importantly, what we need to do. I walk into Upper Allegheny today, and there's a sheet about walkable Olean and the plan that will provide for not just an increase in green space and an attractive improvement in the downtown built environment of Olean, but a bike lane next to a wider sidewalk, next to a more efficient transportation system that allows people to do that thing they want to do, which is go outside. And as you proved again here today, you will go outside no matter what. You will. Other people won't. Other people stay home and say it's raining, I don't feel good, it's snowing, it's too cold. Not you. You just go out. And you've been doing it, and you will continue to do so. And now you're focused in ways other people would be quite jealous of on the built environment right here, right now, in this place. There are other efforts that will go on inside the Institute of Medicine, other efforts in particular through the Roundtable on Obesity Solutions. Again, that's a broad-based now, broader based than ever before, group of folks that involve foundations, government, as well as the private sector and industry. We've moved beyond a focus on children. We're going to focus on prevention, treatment, and weight maintenance. We have a set of ongoing themes, all of which are available online. We have a set of innovation collaboratives that will be involved as well. You can go back and look at our first workshop, which was a complete recap of this work so far. This is where you find the website for not just everything I've said basically, but also the other resources that I've mentioned. Bottom line, schools have a central role, but they can't do it alone. Neither can a governor, neither can a mayor, neither can a first lady, an employer, college president. Knowing what to do, we have concluded, and I hope you will as well, to do it all, to do it now, to all of us do it. And the last piece is there are parts of this that require policymakers and lawmakers to act. Parks aren't something you can do on your own. Neither are sidewalks, by and large. PE teachers are not something you can hire when you go home tonight. funding programs and research, pushing the research knowledge base outward. It's instead your job, I think, and my job to say out loud to the people who can make those things happen that this is something that we want. It's something that we need, and we can't have it without you. We can't have a new policy without your effort. We recognize we have a role. We recognize we have to all be in it together, but we're all going to have to pull together, and that's going to mean not just our government, but ourselves and our neighborhoods will respond. The good news is, again, that after a couple of generations, plus or minus, and an awful lot of heartache and cost, we know what to do. And here in this county, as in much of America, we have a desire to do it. The test is whether we will, and whether we recognize it's a sustained effort that will go on for as far into the future as I can see. There may be good statistics, there may be decreases, and I hope there will be. But we have to sustain this effort, I think not just for our lives, but indefinitely. If we have that commitment, then the epidemic will end. And in fact, our children will be better off than us, and their children will be better off than them. It's one of those areas where we can restore the American dream to that position that it held all of our generations before. That's in our power. That's in our hands. I'm encouraged that this county will do it. I'm encouraged that this region believes in it. The recognition that you already have about the need is so strong, and the work you're doing so positive, and your health system and health supports so important. So thanks for allowing me to think about it with you together, and for giving me hope about this area, hope even greater than Tim Finan ever suggested I would have. Thank you very much. Now, they suggested you might have questions. The only question I can think of is, can we go now? But you can. But if you would like to do just a few questions, but also if you have to leave, we understand that as well. Understand, however, that they actually are filming this. It will be on community access television, and people will see you leave. You can decide. If you stay like you are, they may not know you were here if you weren't supposed to be here. There's one over here, and then I'll come over here.
How do you convince other drugstores like CVS has done it already, to stop selling cigarettes, and grocery stores? I've never seen anybody eat a cigarette.
I mean, it's very interesting, and it's a perfect example, though, of where they made a conscious decision, and I don't know about the internal workings of the company, but a major national American company made a decision not to do something that was highly, highly profitable, believing it was the right thing to do, but also believing, I think, that it would be popular with their consumers and with their customers and be valuable for their shareholders in the long term. It's that kind of change of thinking that's going on, and it is going on. There is a change in calorie counts on well-known consumer products that we've purchased forever, and suddenly the numbers are changing. Sometimes because the portion size has shrunk, which is, I don't mean to be critical of, because I mean, when I started out, it was a big treat to have the largest, well, when we said soda pop, that you could have was 7.5 ounces. You remember that it was a dime. Other people remember it was a nickel, but it was 7.5 ounces. I mean, now, basically, my daughter would say, "What? You're cheating me." But there's an effort to reduce because they perceive the market acceptability is greater. I mean, you are making a difference by the decisions you've already made. I think the answer is when the perception is that's what you want, then they'll deliver it. Yes, sir.
The school in the United States made an attempt to get rid of the junk food that they have. What is the statistical impact of the success of that program to improve the health of the children and to cut down on the obesity?
There are some studies that I will, after the program, direct you to. I would have to say a couple of things quickly. One, many schools, in an organized and others in an individual basis, took efforts in this regard, and much of that was then studied and reviewed. The general feeling, I think, that you'll find from the report is that it has a positive effect, especially when better choices are available. When you simply remove the product, there is then a concern, in fact, that with no substitution and no alternative, there are opportunities out of school to obtain the same thing that you were denied in school. I can put a finer point on that, but I think you understand exactly what I'm saying. So I couldn't have it during the school day. Well, it's available at the store on the way home. Or if it's not available in the store on the way home, it's available in the home. So there is, I think in this case, a need not only to make this not necessarily the only choice, but the better choice available, combined with the marketing and the education, that appears to have sustained results over time. Way in the back.
What are your thoughts on insurance companies not covering nutrition education for the diagnosis of obesity in overweight children?
I mean, you'll find, again, I touched on it very quickly, but I think there's a general feeling and belief that there should be the broadest possible encouragement, both from insurers as well as employers, and hopefully employers can encourage insurers to do that as well.
Can we do anything as a nation? I mean, as a nation, as a community, can we submit something? I mean, I'm a dietitian and we get so many referrals from physicians for adolescent obesity and overweight, and parents are not bringing their children because of not coverage, or they're coming once and then never coming again because their insurance is denying it.
One of the people I would like to refer you to is Michael Kropp at Independent Health up in Buffalo, which is one of the outstanding insurers in this region. And I think he would have better insight than I could possibly provide for all of that. And I will in a broad way, share, in conclusion, my favorite public policy secret. This comes from 10 years in the legislature and 8 years as mayor of a major city, with some experience now with others in that same role. And here's the secret. If you really, really, really want something, the government will do what it can. In fact, almost anything it can to provide it. But you have to really, really, really want it. And they have to know it. When you get to that point, a funny thing happens. It appears. They provide it. The resources become available. So if you keep that in mind in this area, it applies to, in my opinion, across the board. But in this area, if it's something that they understand and have a keen and personal sense of, that it really makes the difference for you, they will go back to the office and say, let's try to do that. And then they will. Thank you all very much.
So I hope you enjoyed the presentation and found it very informative. Certainly obesity is an issue which we all need to address, both in our schools, our hospitals, out in the community, and it's going to take a community effort to make headway about a problem that's causing this nation ill health. Thank you for being with us.